Then assignment 6, exposure is not assigned by the investigator in the following study design. All of the above. All these are observational studies or descriptive studies. Exposure is assigned by the investigator in analytical or experimental studies like randomized control trials. Then which of the following statement is true about cohort study? Both A and B, yeah. Not suitable, yes. Lost to follow up, yes, it can. Then which of the following study design is better to temporal is related to time between exposure and disease? Cohort study. Yeah, this is with time. Yeah, temporal related to time. Relative risk of more than one indicates incidence and exposure higher. Incidence and exposure is higher than, yes, true. If the odds of exposure among cases is lower than the odds among controls, the odds ratio will be less than. Obviously, if the odds of exposure among cases is less than the odds of exposure, yeah. Case control study, right? Yeah. Order of cases is lower than the case control. If order case is lower, the control odds ratio will be less than 1. True. All babies born in a particular form of birth cohort. True. Cohort study suitable for rare diseases. No, false. I disagree with this. It should be common. The following are not true regarding case control study. Not true. It is appropriate for study of rare outcome. Yeah, this is true. For rare, we can do case control. It is more time consuming. No. Case control is less time consuming. Cohort is more time consuming. Then multiple exposures can be examined. Yes. Relatively expensive. No. It is cheaper. Quite cheap. Cohort is expensive. So both 2 and 4. True. Yeah. Then what is an appropriate measure of statistical in cohort study? Risk ratio or relative risk. Yeah. Then the entire population of a given community screened and all those judged as being free of colon cancer are questioned extensively about their diet. These people are then followed up for several years to see whether their eating will predict the risk of developing colon cancer. This is cohort study, yes. Because we are screening them and then we are seeing that they are free of colon cancer. Then they are questioned about their diet and they are followed up for several years. So we are predicting the risk of developing colon cancer. So this is going forward. Yeah, cohort study, prospective study. Yes. They are often followed up for several years. Yes, cohort study, right. Then why not clinical trial, you might ask? Because we are not giving any medicine, any pharmacological intervention, any randomized control trial, something of that sort. Best advantage of randomized control trial is that randomization can be done. Most important thing of RCT. Important. Exposure is assigned by the investigator in which of the following epidemiological study? Experimental, yes, correct. Experimental or analytical or randomized control trial, yes. When a group of people we define it have followed up to determine incidents, it is known as cohort, yes. Follow-up relative risk is a ratio, extremely important. Relative risk is a ratio, yes, it is a ratio. Relative risk of 1 in a cohort study equal incidents in the expo, yeah, same. Women aged 35 years were screened for human papilloma virus, and those who had human were then followed for several years. This is prospective cohort, yeah, because we are going forward in time. If you go back in time, then it can be a retrospective cohort. We are following appropriate regarding a cohort study. Multiple exposures can be examined. I don't think so, no. Only a single exposure. Single outcome, single exposure. Appropriate for studying rare exposures? No. Expensive? Yes. Yes, it is. Appropriate studying rare? No, I don't think so. Studying rare diseases? No. And let us see what the answer is. Yeah, both 2 and 3, right? Correct. Both 2 and 3. So that is appropriate for studying rare exposures. It is expensive and time consuming. Yes, it is. Then which of the following statement is regarding the cohort study is false? Suitable to study the disease with long latency period. Loss to follow-up can introduce bias. Relative risk can be temporal association with the risk factor can be established. Which of the following to study the cohort is false? Suitable to study disease with long latency period. Yes, this is false. Because in cohort study, we can study the disease with a long latency period. Odds ratio of more than 1 indicates odds of exposure among cases, yes, is higher than odds of exposure among the controls. If there is a comparison group and an epidemiological, it is called analytical. Yes, true. Absolutely true. Comparison is in randomized control trial or experimental and analytical studies. The following statement suppose case control cohort studies is correct. Cohort study establishes, yes, temporal association. Correct. Correct. Right. Cohort has lower level of evidence than case control. No, it has a higher level of evidence. Case control for rare exposure. Do case control? No. To determine the associated factors of antihypertensive drug compliance, investigators rated 384 participants with hypertension who undergoing treatment at tertiary care hospital. Then collected details. Okay, took history. But then the drug compliance were compared. 25 factors drug compliance. Case control. Cases and controls. Like here you can see 384 participants with hypertension. Like this is the case. Then control. Yes, here drug compliant group and non-drug compliant group. Okay, after past 2 weeks, see this is a retrospective study, past 2 weeks. A gynecology resident intends to determine the relation between intrauterine device use and risk of extrauterine pregnancy. The investigator recruited 100 cases of extrauterine pregnancy and 200 participants who had intrauterine pregnancy as controls from the obstetrics ward of a tertiary care hospital over a period of 2 years. Both cases and controls were interviewed about the history of IUD use. Among the cases, 6 participants had history of IUD use. Among controls, 4 had history of IUD use. Odds ratio. So I'll just be telling you about this formula.